This conversation is powered by Google Illuminate. Check out illuminate.google.com for more. Welcome to the discussion. Today we're diving into a fascinating paper exploring the intersection of smart contracts, blockchain technology, and sustainable healthcare. It's a rapidly evolving field, and this research offers a comprehensive overview.
Indeed, the potential for smart contracts to revolutionize healthcare is immense, but it's crucial to understand the complexities and challenges involved before widespread adoption.
Exactly. The paper highlights two key roles for smart contracts: process improvement and patient privacy protection. Let's start with process improvement. What are some of the most promising applications?
The paper identifies several key areas. One is the supply chain for medicines and medical equipment. Smart contracts can enhance traceability, reduce counterfeiting, and improve efficiency in procurement.
That's a significant area. Counterfeit drugs are a major global problem, and blockchain's immutability could be a game changer. The paper mentions several examples of frameworks designed to address this. Can you elaborate on how smart contracts are being used to improve the medicine and medical equipment supply chain?
Absolutely. Many frameworks leverage smart contracts to track every stage of the supply chain, from manufacturing to patient consumption. This creates an immutable record, making it much easier to identify and address issues like counterfeiting or product recalls. For example, one study detailed a system tracking controlled drugs, with smart contracts managing registration, production, and consumption stages, ensuring accountability at each step.
And what about the role of government regulators in these frameworks?
Several frameworks incorporate government agencies like the IAEA in the US or similar bodies in other countries. Interestingly, the decentralized nature of blockchain means these agencies can interact with private stakeholders without needing to establish direct trust relationships. The trust is in the system itself.
Beyond the supply chain, what other healthcare processes are being improved with smart contracts?
The paper also highlights applications in insurance claim processing, vaccination passports, clinical research, emergency response, and regulatory compliance. Smart contracts can automate many of these processes, reducing fraud, improving efficiency, and ensuring data integrity. For instance, in clinical research, smart contracts facilitate secure data sharing and aggregation across multiple institutions while protecting patient privacy.
That's a compelling argument for using smart contracts in clinical trials. The ability to securely share and aggregate data could significantly accelerate research. Now let's shift to the second key role, patient privacy protection. How are smart contracts contributing to this crucial aspect of healthcare?
The paper emphasizes the growing importance of patient centricity. Smart contracts empower patients to control their own health data, defining who can access it and under what conditions. This addresses challenges like data fragmentation, breaches, and compliance with regulations like HIPAA and GDPR.
The paper mentions several mechanisms for achieving this. Can you highlight some of the technical approaches used to enhance patient privacy?
Frameworks often employ techniques like patient consent management, where patients define their privacy preferences and the smart contract automatically enforces those preferences. Other approaches include sophisticated access control mechanisms, using technologies like attribute-based encryption or self-sovereign identity models to grant granular access to data. Some even incorporate biometric authentication for added security.
The paper also discusses the technical challenges and strategies for optimizing the efficiency of smart contract-based healthcare systems. What are some of the key considerations?
One major challenge is data storage. Storing large amounts of data directly on the blockchain can be expensive and inefficient. Many frameworks address this by using off-chain storage solutions like IPFS, storing only cryptographic hashes on the chain. Another strategy is to specialize smart contracts, breaking down complex tasks into smaller, more efficient modules. This improves resource utilization and reduces costs.
And what about the choice of blockchain platform?
The paper notes that Ethereum and Hyperledger Fabric are frequently used, each with its own advantages and disadvantages. The choice depends on factors like scalability, security requirements, and the specific needs of the application. The type of blockchain, public, private, or consortium also plays a role.
The paper introduces the concept of system trust in the context of smart contracts. Can you explain what that means?
System trust represents a shift from relying on personal trust to trusting the design and functionality of the system itself. In a smart contract-based healthcare system, trust is distributed across the network rather than concentrated in a central authority. The immutability, transparency, and auditability of the blockchain contribute to this system-level trust.
So it's about building confidence in the system's integrity and reliability rather than relying on individual actors to be trustworthy.
Precisely. The paper characterizes system trust by identifying what is trusted, the smart contract's functionality, who trusts the stakeholders, and how trust is supported, the technical mechanisms.
The paper meticulously addresses potential biases in its literature review, particularly concerning database selection. Why did the authors choose to use only the Web of Science database?
The authors made a conscious decision to use a single database to avoid biases introduced by combining data from multiple sources with different structures and indexing methods. While this limits the scope, they mitigated this by assessing the overlap between Web of Science and other databases like Scopus and PubMed, demonstrating a high degree of coverage.
And what were the findings of that overlap analysis?
The overlap was substantial, indicating that Web of Science provided a good representation of the relevant literature. While some additional studies were found in Scopus and PubMed, they largely reinforced the findings of the main analysis.
Let's summarize the paper's principal findings. What are the key takeaways?
The paper provides a comprehensive understanding of the roles and characteristics of smart contracts in healthcare, identifying two main roles: process improvement and patient privacy enhancement. It also details the technical strategies used to optimize efficiency and build system trust. This goes beyond previous studies that only touched upon specific applications.
The paper also offers a novel perspective on the technical aspects contributing to efficiency. How does this differ from previous taxonomies?
Previous work often focused on technological features like blockchain type or consensus mechanisms. This paper takes a different approach, focusing on the features that enhance efficiency, such as off-chain storage, specialized smart contracts, and optimized node deployment.
The paper highlights the diverse impact of smart contracts on various healthcare stakeholders. Can you elaborate?
Smart contracts offer benefits to individuals, patients, researchers, physicians by enhancing privacy, security, and access to data. They also benefit institutions, hospitals, clinics, governments by improving processes, reducing fraud, and ensuring regulatory compliance. The decentralized nature allows these stakeholders to interact securely without needing to trust each other directly.
What are the main strengths and limitations of this systematic review?
The strengths lie in its systematicity, comprehensiveness, and rigorous approach to minimizing bias. The authors followed PRISMA guidelines, conducted a peer review, and carefully assessed database coverage. However, the decision to use only one database is a limitation, although the overlap analysis helps to mitigate this. The restriction to open access documents is another limitation.
What are the key conclusions and directions for future research?
The paper concludes that smart contracts are a promising technology for enhancing healthcare, offering significant benefits to various stakeholders. However, challenges remain, particularly concerning data storage and resource utilization. Future research should focus on specific areas like the unique needs of children's health data, applications in low and middle-income countries, modeling real-world behaviors into smart contract systems, and a more thorough cost-benefit analysis of smart contract adoption in healthcare.
The paper also points out the need for more research on the impact of the internet connectivity on smart contract adoption.
Absolutely. Reliable internet access is crucial for the successful implementation of these systems, especially in remote or underserved areas.
The paper suggests several specific areas for future research. Can you elaborate on the need for research focusing on children's health data?
The concept of patient centricity is complex when dealing with minors. Children and teenagers may have limited control over their health information, requiring careful consideration of parental or guardian involvement in data management and consent processes. There's a significant gap in research on privacy protection for children's health data using smart contracts.
What about the application of smart contracts in low and middle income countries?
While smart contracts offer potential solutions to challenges faced by these countries, such as counterfeit drugs, there's a need for more research tailored to their specific contexts and resource constraints.
And the importance of understanding real-world behaviors.
Smart contracts implement business logic, but this logic must accurately reflect real-world interactions and behaviors within the healthcare system. More research is needed to understand how these behaviors can be effectively modeled and incorporated into smart contract designs.
Finally, the need for a more comprehensive cost-benefit analysis.
While some studies have touched upon cost, a more thorough analysis is needed to understand the economic implications of adopting smart contracts in healthcare, comparing costs with traditional methods, and considering factors like implementation costs, maintenance, and long-term benefits.
This discussion has provided a comprehensive overview of the paper's key findings and implications. It's clear that smart contracts hold significant promise for transforming healthcare, but careful consideration of the challenges and ethical implications is crucial for responsible and effective implementation.
Precisely. The potential benefits are substantial, but a thoughtful and measured approach is essential to ensure that these technologies are used to improve healthcare access, quality, and equity for all.
That was a great discussion. Thank you for your insights.